Welcome. Today we're diving deep in a kidney disease called focal segmental glomerulosclerosis, or FSGS. It's a mouthful, I know, but understanding it is crucial for those affected and their loved ones. We'll explore what it is, why it happens, how it's diagnosed, and what can be done about it. Let's get started. So, what causes FSGS? The truth is, in many cases we don't know the exact cause. This is called idiopathic FSGS. However, there are several known risk factors and potential causes. These include genetic mutations, viral infections like HIV or parvovirus B19, certain medications like anabolic steroids or interferon, and underlying conditions like morbid obesity or sickle cell disease. It can also be secondary to other kidney diseases like reflux nephropathy. Essentially, anything that puts a strain on the kidneys or damages the glomeruli can potentially lead to FSGS. Now, let's talk about what's actually happening inside the kidneys. FSGS primarily affects the glomeruli. These are tiny filtering units in your kidneys that clean your blood. In FSGS, some glomeruli become scarred, and these scars only affect parts or segments of these glomeruli. This is where the focal and segmental parts of the name come from. As these glomeruli become scarred, they lose their ability to properly filter waste and protein, leading to protein leaking into the urine. This protein loss can cause fluid retention, swelling, and a cascade of other problems. FSGS isn't a very common disease, but it's a significant cause of nephrotic syndrome, a kidney disorder characterized by high levels of protein in the urine, low levels of protein in the blood, edema, and high cholesterol. It affects both children and adults, but certain populations, including African Americans, have a higher risk of developing FSGS. The incidence of FSGS appears to be increasing, though the exact reasons are not entirely clear, but likely involve greater awareness and improved diagnostic testing. The symptoms of FSGS can vary from person to person. Often, the first sign is edema or swelling, particularly in the ankles, feet, and around the eyes. This is due to the loss of protein in the urine, which disrupts the fluid balance in the body. You might also notice foamy urine, which is another sign of protein leakage. Other symptoms can include weight gain from fluid retention, fatigue, high blood pressure, and in more advanced cases, decreased kidney function and eventual kidney failure. Diagnosing FSGS usually involves a combination of tests. First, a urine test will check for protein. If significant protein is detected, blood tests will be done to assess kidney function and protein levels in the blood. However, the definitive diagnosis requires a kidney biopsy. In this procedure, a small sample of kidney tissue is removed and examined under a microscope to look for the characteristic scarring of the glomeruli. FSGS isn't just one disease. It can be classified based on its underlying cause or appearance under the microscope. Primary FSGS, or idiopathic FSGS, means the cause is unknown. Secondary FSGS is caused by another identifiable condition, such as those we mentioned earlier. There are also different histologic variants of FSGS, including the collapsing variant, tip lesion variant, and cellular variant, each with slightly different characteristics under microscopic examination. Knowing the specific type of FSGS can help guide treatment decisions. The treatment for FSGS aims to reduce protein loss, control symptoms, and slow down the progression of kidney disease. Often this involves medications to lower blood pressure, especially ACE inhibitors or ARBs, which can also help reduce protein in the urine. Immunosuppressant drugs like corticosteroids, cyclosporine, or tacrolimus are often used in primary FSGS to suppress the immune system and reduce inflammation in the kidneys. Diuretics can help reduce fluid retention and swelling. It's also important to manage underlying conditions, such as obesity or infections. In advanced cases, dialysis or kidney transplantation may be necessary. Unfortunately, there's no guaranteed way to prevent FSGS, especially idiopathic FSGS. However, you can reduce your risk by managing conditions like diabetes and high blood pressure, avoiding medications that are known to damage the kidneys, maintaining a healthy weight, and promptly treating any infections. If you have a family history of kidney disease, it's important to talk to your doctor about screening and monitoring. The prognosis for FSGS can vary widely. Some people respond well to treatment and can maintain stable kidney function for many years. However, FSGS can be a progressive disease, and many people eventually develop kidney failure. Recent research is focused on identifying new genetic markers and developing more targeted therapies. For example, clinical trials are exploring the use of novel immunosuppressants and therapies that target specific pathways involved in glomerular injury. Understanding the specific mechanisms driving FSGS in each individual is crucial for personalized treatment approaches and improving long-term outcomes. It's a constantly evolving field, offering hope for better treatments in the future.